A successful dental practice depends on its staff to thrive. It's much more than just a good doctor and lots of patients. Even the complexities of telling patients what they need ultimately involves everybody in the office. When patients pull you aside and ask about various types of care, it's important that your response support the doctor's recommendations. Encourage them to accept his proposed treatments. After a new patient joins your dental practice, at some point they must be formally told what they need. Most of the time, this is done in a setting called the treatment plan presentation or the case presentation. You won't be able to successfully make specific treatment recommendations unless you believe in them yourself. And for patients to want what you have to offer, the entire staff must have certain values that patients will perceive. These values include that patients deserve perfect periodontal health, that children benefit from sealants, that all patients could ultimately benefit from cosmetic dentistry, that dentists are well educated about what they do, and that the entire dental team is there to help the patient. Many other services your practice offers, like tooth whitening through bleaching, dental sealants, and others, can be shared in many presentations with the patient throughout the course of their visits. These are times when the whole staff plays a big role in helping patients utilize the full spectrum of services that you and your doctor can offer. Many of these more elective treatments are provided by dental assistants, freeing the dentist and the hygienist for therapeutic care. You get to directly participate in patient care in many interesting and challenging ways. It's a quirk of human nature, but few people like to be sold things. We all enjoy buying, but hardly anyone wants to sit with a salesperson and be pitched. So if we aren't careful, the patient may feel pressured and actually resist beneficial dental treatment. Yet we are all selling all day long. From encouraging our kids to brush their teeth or to do their best in school, to explaining to our spouse why we'd like to play tennis instead of doing the laundry, in any given day we probably spend more time selling than we do eating. There is a right way to help people make treatment decisions and follow through with them without any semblance of coercion. And counter to what you may think, you don't want to explain every possible detail. You don't want to press the patient for a commitment. You must remain unfazed by patient questions, concerns, and objections. You should not be offended when patients want second opinions. And finally, you should not let the patient's financial concerns or dental insurance affect the treatment planning. Those are all bold statements, and we'll deal with them during this film. We'll also be discussing how to share treatment options with patients and how to help motivate them to accept treatment. Unlike some major purchases, like large televisions and new cars, all of which are long lost and forgotten in a few short years, dentistry is a lifelong investment. It's for this reason that you should feel good about sharing treatment ideas and encouraging patients to follow through with them. When you factor $3,000 or $4,000 in dental care over 20 years, the $150 to $200 per year or $3 or $4 a week spent has few comparisons for value. The same holds true for time, which is even more precious than money to most people. Factor 6 or 7 hours of treatment during the next few months out over 20 years of enjoying the dentistry. The patient's time investment is just 18 to 20 minutes per year. And over those 20 years, they have lower dental expenses, less chance of losing teeth, more dental comfort, a prettier smile, and all of these because they consented to comprehensive care in the first place. We'd like to share several key points with you that will help your patients accept your treatment recommendations. Remember, just because they made that first appointment doesn't mean that they're totally sold on you yet. When you reassure them of their treatment choices, when you gently guide them toward comprehensive care, and when you suggest elective treatments that can help improve their lives, everyone wins. We'll show you how. Also, we'll look at why their first visit should be with the doctor. And you'll learn how to instill the value of comprehensive dental care in their spending attitudes. Now let's discuss these ideas in more detail. If you've ever noticed You see your doctor reassuring his patients in every moment, reassuring them of their decisions for care, of favorable outcomes, of comfort. It's automatic because he truly cares for their well-being. As you spend more and more time with your patients and they get to know you better, you'll find them asking you questions too. A lot of the time they already know what the answer is, either because the doctor just told them or they know deep down and simply want some reassurance. You can be very influential in patient reassurances, even as early as their initial contact with you by telephone. Most dental practices make the first phone contact a somewhat one-size-fits-all call. They get the patient's name, find out what they need, and make an appointment. Well, there's a better way without ignoring these three mentioned needs. This first call is your first chance to reassure them in choosing your practice. By taking just 30 seconds to share your pride in your doctor and the practice, you can shave hours and maybe even days off the time normally needed to gain their full trust. Listen to this telephone script and contrast it with how you've heard so many telephone conversations. Front desk. Thank you for calling Dr. Allen's office. This is Kelly. How may I help you? Patient. I'd like to make an appointment. I've never been there before. Front desk. Wonderful. We're always excited to have new patients join us. Are you having any problems now? Patient. No, I just need a checkup. Front desk. Well, that's great. Let me tell you a bit about our practice. Dr. Allen is a terrific dentist. He's studied extensively with the country's leading clinicians and faculty, and in fact 3 weeks ago he participated in a workshop in St. Louis. He learned the latest advancements in patient comfort. He's not just up to date on all of the latest dental procedures, he's gentle too. You're really going to love him. In fact, he's my dentist. I'd like to schedule an appointment for an initial exam, and then we can schedule a recare appointment after that to help take care of all of your hygiene needs. How does Monday, December 3rd at 3 o'clock sound? Patient. That sounds fine. Front desk. Let me ask you a couple of quick questions so we can be fully prepared for your visit. Is that okay? Patient. Sure. Front desk. First, who may we thank for referring you? Patient. Sam Baker. He's a patient there. Front desk. Oh, Mr. Baker's a wonderful man. It was so nice of him to refer you to us. And so it goes. Now, doesn't that conversation sound wonderful? Could you imagine being that patient? Is there any other way to help a patient actually look forward to a dental appointment? Your practice has a philosophy, or a mission statement as it's now known, whether it's written or not, and it's somewhere in the range between emergency and comprehensive state-of-the-art dental care. As the dental assistant, you're in a wonderful place to help patients begin making decisions about their treatment needs and guide them toward the type of care that serves them best. Now, the entire dental practice must be in agreement on what's best for the patient. If patients get conflicting messages and answers, the chances are they won't subscribe to anything that your practice can offer. And why is this? It's because a confused patient never accepts a treatment plan. If the dental office you now work in provides only comprehensive care, then you know how it benefits everyone over providing simply emergency treatments. With comprehensive care, patients know ahead of time what their financial investment will be, and they can plan for it. With comprehensive care, patients have healthy teeth and healthy gums, and the confidence that goes with good dental health. It allows them to concentrate on other meaningful activities in their lives. Providing comprehensive dentistry is very important to the doctor, too. It prevents burnout. Comprehensive dentistry is predictable. It's dependable. It's satisfying to patients, and so it's satisfying to the doctor. It's what makes being a doctor so fulfilling. And finally, comprehensive dentistry lends a tremendous boost to staff morale. It slows things down. So instead of preparing for cleaning up and treating and working with 20, 30, or 40 patients a day, you may work with just 10 or 12, so everyone stays fresh and ready to tend to patient needs. And plus, it's now common knowledge that high-volume dentistry simply doesn't work. It doesn't promote quality, it doesn't lessen stress, and it usually doesn't make for happy patients. And I say usually because, well, maybe a few, just because things are a bit cheaper. Still, nobody appreciates persistently running behind, being ignored, or just being one of the masses. Even if quality care were to be provided, patients may still feel let down. They won't stay with the practice. Today, patients are looking for patient-oriented dental practices where they are well cared for. They want to look to you as their professional oral health consultant. After all, you are the expert. You're going to be their personal trainer, their personal coach. You're part of a team that's going to help them win back optimal oral health through comprehensive dentistry. So call it selfish, but everyone can afford to be selfish in a healthy way regarding comprehensive dental care. If you know what the doctor is going to share with the patients in his treatment plan presentation, then you should know what to share with them beforehand to help build their confidence. It makes the doctor's job easier at the same time. Better yet, it makes you look really good, since patients might be heard to say, "Wow, Amy said I might need that." After all, you're all on the same team, so guide the patient toward thinking, "These are all consultants, helping guide me through this decision-making process." Over the patient's life with a practice, staff members actually spend more time with the patient than the doctor does. It's a simple fact. In offices where patients see the hygienist at their first visit, during that visit, the dentist is with the patient only for about 4.5 minutes during his exam. That's too precious little time to suggest tooth whitening or closing a space between the front teeth with veneers. But somewhere in the time you're with them, you can mention the procedure and recommend that they ask the doctor about it. What do you currently do with the 6 hours or so that you're with a patient during their treatments?